Thank you, Mr. Blake. But Blake had the short drive this time, and Adam had the long drive. He come out here from Strasburg, PA, so he had about a 425-mile drive, thereabouts. So he's from the Special Needs Children's Clinic located in Strasburg, PA. So Mr. Adam is going to be up next. He's a director at that clinic, so here you go.
Good afternoon, everyone. My name is Adam Heaps. I'm the executive director at the Clinic for Special Children, which is in Lancaster County in Pennsylvania. If you've been to this auction before, or you've been to any of the auctions that support the clinic, you know that we typically have one of our physicians come and talk to the audience and talk about some of the things that we're doing. I have no clinical training whatsoever. You do not want medical advice from me. I am not a doctor. So you may be wondering, why am I standing here before you? And I'm standing here before you because it's really hard to control when babies are born. So let me explain a little bit. How many people here have heard of a disorder called spinal muscular atrophy, or SMA? Can you show me your hands? A couple people? Okay, great. So there's a baby born this week with SMA in Lancaster County. If you're not familiar with SMA, it's a genetic disorder where there's a degradation of the nerves in the spinal cord due to their genetic problem. That eventually leads to muscular atrophy and eventually to death. And depending on the severity of the disorder, that process sometimes goes faster for some patients or slower for others. And I won't bore you today with what the differences are, but it's a pretty terrible disorder. For many years, there was really no treatment for SMA. You could treat the symptoms, but it was really hard to treat the disease. About 2 years ago, there actually were 2 treatments that were put out into the world. One is commercially available, it's FDA approved. Patients can get to it. It's called Spinraza. And if you've been seeing our newsletters for the last couple months, you've seen some stories in there about how we're helping existing SMA patients get access to that very costly treatment. And that's really been important work. But there's a second treatment that's currently being worked on, is not commercially available, and it's a gene therapy. So if you're not familiar with what gene therapy is or how it works, in brief, you introduce a virus to patients intentionally, and that virus has been engineered to have the DNA that patient is missing inside of it, and then goes throughout the body and injects that DNA into cells. It's like releasing millions of little hypodermic needles into somebody. And in theory, at least, that DNA sits inside of the cell and it creates the protein that patient cannot make because of their genetic disorder. So there is a gene therapy for SMA, and it's still in phase 3 clinical trials. Now, I'm happy to announce that the Clinic for Special Children is one of the clinical sites for that gene therapy trial. We're one of 26 sites in 13 countries across the world. And as an aside, I just have to say, it's very interesting. If you look at the list of the sites, you see a lot of very impressive medical institutions all across the country. And then you see the Clinic for Special Children, this little clinic in rural Lancaster County. So, back to why I'm here, standing in front of you. Because of confidentiality around that study, I can't say if a patient is being dosed or isn't being dosed, or how that patient is doing, or if it's working or if it's not working. But I will tell you that Dr. Strauss, our medical director, Dr. Carson, our pediatric neurologist, Carla Brigatti, our research operations director and genetic counselor, are all very busy this weekend. And we're not able to make it here, unfortunately, today, but they send their regards. So you can read into that however you want. So instead of regaling you with specific patient stories or trying to dazzle you with explaining complicated disorders, I'm just going to tell you about some of the things that I've seen over my 8 years at the Clinic for Special Children as a scientist and as an administrator. I've seen children who have genetic disorders where they should be deaf, who can hear because they have a cochlear implant. I've seen children who grow up to be young adults who have metabolic disorders where not long ago they would be wheelchair bound or possibly have even passed away, and they're having families of their own. I've seen parents who are dedicated to doing research, who have disabled children, and when you ask them, why are you even participating in this research? You know that it may not help your child. They say, I'm helping because it may help somebody else in the future. And that dedication is inspiring. I've seen children who come into the hospital who are in a coma, and their parents have driven 10, 12 hours to get to our center at the Lancaster General Hospital, and they're exhausted. And I've seen that same patient weeks later in our office, healthy, the parents relaxed, or at least as relaxed as you can be with a newborn. I've seen patients who we tell the parents that their child is going to be okay. We've checked their blood, they don't have a disorder we're looking for. And I've also seen families and seen the heartbreak on their face, and we have to tell them that we've diagnosed their child with a devastating or even a fatal disorder. I've seen a child in the ICU hooked up to a dozen machines doing different things, breathing for the child. Child's unresponsive, not even conscious. I've seen the look of exhaustion on the physician's face who's taking care of that child, who's practically living at the hospital on days on end trying to give that child a shot at life. And I've seen the heartbreak and the despair on that same physician's face when the child doesn't make it. I've seen a lot of things. I've seen ups, I've seen downs, I've seen highs, I've seen lows. I've seen successes, I've seen failures. And the successes and the highs and the ups, those are great. They nourish the soul. They're important. But it's those lows that really matter. And to me, the measure of a person is what you do after you've experienced one of those lows, how you respond to it. And time again, I've seen at the Clinic for Special Children, our staff responding to those lows by saying, we're going to learn from this, we're going to do better, we're not going to let this happen again, or we're going to have a better outcome the next time. And that's really inspiring. So I see a very dedicated staff who day in and day out is thinking about how you can work with children who have difficult circumstances and how you can give them the best shot at life. So thank you. Thank you for being here. You are the ones that allow us to try and try again. You are the ones that are dedicating your time to be here and support us in the DDC clinic, which is doing also very important work. And to me, one of the great unknowns in life is how much time we have in this world. I think mere mortals don't necessarily know that information. And so, spending some of that time with us today, we really appreciate that. So, whether you're just here to socialize with friends, or whether you're somebody who buys the most expensive item here today, we thank you for your participation. We thank you for allowing us to do such important work. Thank you.